Hi guys, Dr. Karlinsky here, and welcome to my preoperative video series that I'm doing to help my prospective patients or patients who are already scheduled for surgery to get ready for your operation and hopefully alleviate some of your concerns, answer some of your questions, and to give you a little bit more of a peace of mind before your operation. This particular video is for information regarding BBL or Brazilian butt lift or liposuction with fat grafting to your buttock. This is one of the most common surgeries that we do. Miami, of course, is known for this operation. There's relative to the rest of the country, I think in Miami we do way more BBLs than anyone else in the nation. And so it is something that is very common here. But I find that there's a lot of misconception. The information that I give you in this video, please remember, is what I advise my patients. Different surgeons have different approach, and there's no right or wrong. There's just many, many different ways of doing things, and individual surgeons have individual opinions, experiences, and advice for their patients. And so what I tell my patients and what I tell you in this video is really my opinion and my advice. And remember, there are many different ways of doing things. For my BBL patients, it is very important that you carefully consider the reasoning behind you want to have a BBL, or the reasoning behind you're scheduled for a BBL. The reason why I say that is because not infrequently I have patients who come in for BBL but really require an abdominoplasty or a combination abdominoplasty BBL combo. If you happen to have significant amount of muscle separation, if there's a lot of laxity in the skin, especially in the front where you have an apron of skin hanging because of whether it's weight loss or pregnancy, weight gain and then weight loss, it's not a good idea to do BBL first and then come back for a tummy tuck. It's not a correct order of things. It is much better to address your abdomen, to make it tight, make it as flat as possible, and either do a combination if you're a good candidate, or simply come back to fight another day. Get a tummy tuck first, make sure that your belly looks good, and then after everything is healed, 9 months to a year later, you come back and you do a BBL. Remember that the social media and what has been sort of posted and the things that you see around sometimes creates a very inaccurate picture for patients and also gives you unrealistic expectations. Remember that the results of your BBL depend on what you're starting with, and that's very important. The other thing to remember is that fat transfer is transfer of a free graft, meaning that we take away the fat from one place and we put it in another place of your body, in this instance into your buttock. That means that the cells that we transfer, the fat that we transfer, has to acquire a new blood supply in order to survive. We know statistically, and at least that's what I tell my patients, that approximately 40% of what we put in does not survive. And probably it's less than that, more fat survives than that, but I feel that it gives you a more of a realistic expectation so that you don't feel disappointed that somehow something went wrong. But we know for sure not everything will survive. And so I always tell my patients, if you wake up after your BBL and you're horrified because your bottom looks way too big, please don't panic. It will come down substantially. Vice versa, if you wake up and you look in the mirror for the first time and you say, oh my God, this is exactly what I wanted, please don't hold on to it. Still about 40% of the fat will go away and it will come down in size. It's a way for you to remember that what you see after surgery is not a final result. Now, I know that many of you have heard about the risks associated with BBL. Fat emboli, patients have died, many patients have died, and at this point we have gotten very, very good and very safe at doing the procedure with ultrasound guidance. We never inject the fat under the muscle or really even close to the fascia of the muscle. But remember, it is still a real surgery. And just like any operation, there's always potential risks for infection, bleeding, poor scarring, significant fat necrosis, potential need for revision surgery. One of the things that I always mention to my patients is that if you have a lot of dimpling in the skin of your buttocks, it doesn't necessarily mean that all of it will go away with a BBL. When somebody has a lot of dimples, there's a way we can make it better, but I never promise my patients that it'll be completely gone. Now, a lot of you will feel that you don't have enough hip, more of an athletic body type. Now, remember that space too, especially on the sides, is limited. We can only put in certain amount of fat, and after that there's just no more space, because remember, if I just clump in the fat in these big sort of globs, the only fat that's able to survive is the fat that's abutting your native healthy tissue. Everything that's inside this glob will never get the blood supply fast enough and will simply die off. And that creates more potential risk for fat necrosis, sterile abscesses that have to be opened, removed. And so remember, BBL has certain limitations, and they have to be accepted in order for you to be happy with the surgery. So, you know, sometimes patients will come in and say, I want Cardi B butt. It really depends on what you're starting with. And I always tell my patients, and you'll hear me tell you this on the day of your surgery and on your preoperative visit before your surgery, I will put in as much fat as I can safely, safely being the key word. So it'll be as big as I can make it based on what the starting point is. Now, the story with fajas and sitting on your butt. As far as the compression garment go, I always teach my patients, please wear something that's comfortable. The garment is designed to give you support. It does not do anything for the results. In fact, I always feel that when patients try to stuff themselves into super tight garments that dig into your skin, the potential for problems becomes much higher. I have seen patients get indentations. I have seen patients get necrosis, blisters, fungal infections. So please be careful. Use your judgment. If you're trying to put something on and it's really painful, you should not be wearing it. The garment is there to give you support. Now, sitting on your butt. And I know this sounds a little bit strange because you hear very different things on internet and social media. For my patients, I do not ever ask my patients to stand for 3 months after surgery. It's completely unnecessary. It's okay to sit on your butt, even immediately after the operation. The only thing I ask is that you don't sit down in one position and you stay that way for a long period of time. Try to move around, you know, maybe go a little forward. In a few minutes, 10 minutes or so, try to move your body a little bit one side, a little bit the other side. Just change positions so that you're not putting pressure in one place for a long period of time. And just get back to normal life. Don't let it drive you crazy. I can tell you that in 15 years of me doing it, I've never had a patient come back and say, everything is gone, nothing survived because I was sitting on my bottom after surgery. Has never happened. So please make it easy for yourself. Don't torture yourself. Just get back to normal living. Now, as far as your preoperative labs and workup, I do ask that you watch the preoperative lab work video. It'll give you all of the information because all of that information is really the same for all my patients. Same thing goes for BMI requirements. And again, if you are not sure if you're a good candidate or not a good candidate, you have my number, I think, on the bottom of the screen. You can also find it on my Instagram, Dr. Karlinsky. You can send me a WhatsApp. I always advise my patients to send me a picture from the front, side, and the back. Remember, no face, because for privacy reasons, and I will be able to advise you and make sure that you are in fact a good candidate for a BBL. I hope this helps, and if you have any questions, please don't hesitate to contact me. Thank you.